one series on Krok 1 preparation. Today we are going to taking you to a series of question and answers of Krok 1, and today we are going to start from 2016. But before that, I'd like to recommend that you go to the Krok Center and download the questions over there. But by the end of this video on my YouTube channel, I will put it beneath, the link beneath, so you can go there and download it. So let's just begin. Question 1. A 35-year-old man has been delivered into a surgical ward with a suppurating wound in the neck, anterior to the trachea. Now there is a space. Now this is just a clue for you. They said previsceral space. So take note of that, previsceral space. If a surgical operation is not performed urgently, there is a risk of infection spreading to... First of all, what is a suppurating wound? A suppurating wound is simply a wound that produces or discharges pus. Now, a pus is just a thick yellowish or greenish liquid that is produced in infected tissue. Now, talking about the clue they give us, they say previsceral space. This is just a space that is surrounding the trachea and lying against the anterior wall of the esophagus. Now, below this space is the anterior portion of the superior mediastinum. Take note, is the anterior portion of the superior mediastinum. So again, we've got a clue over there that this spreading is going straight into the anterior mediastinum. So check your answers. A, they said thoracic. The answer is thoracic cavity in the anterior mediastinum. Very easy. Now, for the benefit of learning, let me just quickly explain what a mediastinum is. Now, a mediastinum is simply the central compartment of the thoracic cavity. It is divided into two. We have the superior mediastinum and then we have the inferior mediastinum. The inferior mediastinum is further divided into three components. We have the anterior, the middle, and the posterior mediastinum. Division is in relation to the pericardium. So the area in front of the pericardium is the anterior mediastinum. The area containing the pericardium is the middle mediastinum, and the area posterior to the pericardium is the posterior mediastinum. So from our option, obviously, our answer is the anterior mediastinum of the thoracic cavity. Question 2. Characteristic sign of glycogenosis is muscle pain during physical work. Blood examination usually reveals hypoglycemia. Hypoglycemia simply means low amount of glucose. Now, this pathology is caused by a congenital deficiency of the following enzyme. First of all, you have to understand what glycogenosis really means. So what then is a glycogenosis? In other words, we call it glycogen storage disease. These are a group of inherited disorders that affect glycogen metabolism, either its degradation to glucose or its synthesis. So when there's a problem with how glycogen is being broken down and how it is being stored. Now, glycogen is simply the storage form of glucose. In animals or in human beings, we call it glycogen, and in plants, we call it starch. So there can be deficiency in how these things are either broken down or synthesized. That is glycogen. That is glycogenosis. Now, depending on the type of enzymes that are affected, we have different kinds of it. a lot of them. But for the benefit of learning and our future profession, I'd like to give you some few of them, about 6 of these glycogen storage diseases or these glycogenosis. We have type 0, the enzyme deficient is glycogen synthase. We have type 1, the enzyme deficient is glucose 6-phosphatase. We call it von Koech's disease. We have type 2, that is acid alpha glycosidase or glucosidase, that is Bumper's disease. We have type 3, we call it the Corey's disease, that is as a result of deficiency in glycogen debranching enzyme. We also have type 4, that's glycogen branching enzyme, we call it the Anderson disease. We have type 5, that's muscle glycogen phosphorylase. We call it that's the McArdle's disease. Then we have type 6, that is the Hare's disease, liver glycogen phosphorylase. So now let's go back to our question. They said there's muscle pain during physical work. So we're talking about what? Muscles over here. Now look at the options. We have amylase, we have lysosomal glycosidase, then we have glucose 6-phosphatase dehydrogenase. We also have glycogen phosphorylase. Now our answer here is glycogen phosphorylase, because this glycogen phosphorylase is very specific. It's dealing with what? The glucose in muscles. Now we can also have lysosomal glycosidase. It is also as a result, that's Bumper's disease actually. Acid alpha glucosidase. Another name is the lysosomal glycosidase. So take note of it. But Bumper's disease is not the same as McArdle's disease, that is in muscles to be specific. Bumper's disease is very broad. It comprises even in the liver and everywhere. So take note of it. So amylase is definitely not our answer. Our answer is glycogen phosphorylase. Question 3. Histologic specimen of a kidney demonstrates cells closely adjoined to the renal corpuscles in the distal convoluted tubule. Their basement membrane is extremely thin and has no folds. These cells sense the changes in sodium content of the urine and influence in renin secretion occurring in the distal glomerular cells. Name these cells. So the question here, or what we are looking for here, is among the options, which one of them is sensitive to the changes in sodium chloride or in sodium? Distal glomerular cells are simply involved in the renin-angiotensin system. Podocytes are interested in the filtration in the glomerulus system. The macula densa is simply the cell that are sensitive to the concentration of sodium chloride in the distal convoluted tubule. So our answer here is the macula densa. Question 4. Bacteriological analysis of tap water has resulted in the following. Total bacterial count is in 1 milliliter of water is 80. Calling index is 3. What will be the conclusion? This was one of the new questions that occurred, so let me take my time to explain to you. Now, a calling index simply characterizes the number of E. coli in 1 liter of water. The number of E. coli in 1 liter of water. And in a coli titer It is an index which characterizes the amount of water in milliliters which contain 1 E. coli. So the calling index is usually determined by the number of microbes, usually in E. coli, per liter or kilogram of the substrate. Now the calling index is an important criteria for the control of sanitation and hygiene. Now the point here is this: a good drinking water should not have more than 100 microbes in 1 milliliter of water. Not more than 100. So look at the question. They said the quality titer is what? 80. 80 is even less than 100. So obviously it is very safe for drinking. So let's look for our options. So our answer here should be the water is safe for consumption. Water is safe for consumption. Number 5. I'm trying to be as fast as possible, but we need to understand it too as we go on. Number 5. The process of metabolism in the human body produces active forms of oxygen, including superoxide anion radical, that is O2 minus. This anion is inactivated by the following enzyme. Come on, look at the option over there and look at this one. Just need a clue. You don't have to understand what the question really means. But if you see the question, you can see superoxide anion. So definitely the thing that comes into mind is superoxide dismutase. Superoxide dismutase. Question 6. What kind of muscle contraction occurs in the upper limb during an attempt to lift a load beyond one's strength? Now, the main thing is that when you are lifting a load that is beyond your strength, you are stagnant. Your muscle tone is contracting actually, or there's force coming in the muscles, but there's no movement. And that kind of contraction, we call it isometric contraction. In the case of gymming, where you lift a metal up and down, we call it isotonic, meaning that there's no change in muscle tone. It remains constant because you can lift it, so it remains what? Constant. The muscle remains constant. It doesn't change any further. But even with respect to the isotonic, we have two kinds. We have concentric and then we have eccentric. Concentric means you are shortening the muscles. Eccentric, you are kind of lengthening it. So know the difference between isometric contraction and isotonic contraction. So when I'm getting a low, for example, when I'm holding books in my arm, you can hold it for a very long time. At a point in time, a force is generated to keep those loads up and to prevent it from falling. That is isometric, and that is in the case of the question that we have over here. So our answer is isometric contraction. Isometric contraction. Number 7. A patient suffers from high fever, apnea, pain in the thorax on the right. Fluorosynthesis yields 70 milliliters of yellow-green viscous liquid. Make the diagnosis. What is your diagnosis? Now don't forget, yellow-green viscous liquid. That is what? A pus. So when you check in the thoracic cavity or in the pleural space, they were able to withdraw some pus from it. So which among these diseases can give us that kind of characteristic feature? Now, our answer here is pleural empyema. What then is pleural empyema? Pleural empyema, another name for pleural empyema is purulent pruritus. Purulent pruritus. Now the word purulent simply means pus or accumulation of what? Pus in the pleural cavity. That is developed when bacteria invade the pleural space. So among the options that we have here, the closest answer is pleural empyema, which is just another name for purulent pruritus. So don't think too far. Your answer is pleural empyema. Okay, so let's move on to question 8 because of time. A patient suffers from disrupted patency of the air lungs at the level of small and medium-sized bronchial tubes. What changes of acid-base balance can occur in the patient? Now, our answer here, to narrow your thinking, we are not talking about metabolism. So forget about the metabolism or the metabolic acidosis, metabolic alkalosis. Forget about them. Our answer here has to do with what? Respiration. So our answer is either respiratory acidosis or respiratory alkalosis. Now, at what point do we have respiratory acidosis? In the case whereby we have hypoventilation. When we have hypoventilation, it means that oxygen is not getting into our system. And as a result, carbon dioxide is not also what? Coming out of the system. So what happens? A lot of carbon dioxide is built up in our tissues. And that is causing acidosis. Now in the case of hyperventilation, that means there's excessive amount of oxygen entering into the system. And then excessive carbon dioxide is also what? Going out of the system. So what do we have here? We have a lot of what? Oxygen, thereby increasing the pH of our system to be more what? Alkaline. So in that case, we have what? Respiratory alkalosis. That's more alkaline in the system. For hypoventilation, we have low pH. That is what? More what? Acidic. And then in this question, they said there is what? A problem with our middle or with the small and medium sized bronchial tubes. That means that there is what? Hypoventilation. So what is your answer? Hypoventilation is respiratory acidosis. That means more carbon dioxide is built up in our lungs, causing acidosis. Number 9. Upon toxic damage of hepatic cells resulting in disruption of liver function, the patient develops edemas. What changes of blood plasma are the main cause of edema development? When the oncotic pressure in the blood is low, oncotic pressure is maintained by sodium chloride and by proteins. So when we are dealing with blood plasma, so we are dealing with proteins here, and with the proteins, albumin is the highest. So when there's a problem with albumin in the blood plasma, definitely a lot of water in the plasma will move into the interstitial tissue or the extracellular matrix. So our answer here is decrease of albumin content. Decrease of albumin content. So when there's decrease in albumin content, obviously oncotic pressure is lowered in the plasma itself. And hence, because of osmolarity, more water will be drawn from the vascular system into the interstitial tissue. Question 10. A 6-year-old child with suspected active tuberculosis process has undergone diagnostic Mantox test. What immunological preparation was injected? Now, anytime you hear of Mantox test, it is just a test that is usually performed to diagnose tuberculosis. And what is used here is tuberculin. So tuberculin is the sensitive test that is used to identify tuberculosis or to diagnose tuberculosis.